Hi, my name is Walter Miranda Sanchez. My topic is Influence of Fatigue and Anticipation on Knee, Kinematics and Kinetics during on-job cut maneuver. Definition. Anterior cruciate ligament injuries are one of the most common knee injuries in sports, with a higher incidence in women. Many studies have been conducted to determine the risk factor and gender difference that includes susceptibility to these serious ligamentous injuries. Some of these possibilities are difference in anatomical structures, biomechanical, neuromuscular, and hormonal factors.
In this video, you'll be able to learn about anterior cruciate ligament injury, one of the most important ligaments that hold the knee into position. Injuries to the anterior cruciate ligament are common in young athletes, especially in women participating in sports requiring rapid direction changes or pivoting on the lower extremity with a planted foot. A rapid, severe onset of pain with a popping sensation at the time of injury with significant swelling with fusion or hemarthrosis, which is collection of blood within the joint, causing joint instability, is seen with cruciate ligament tears. Anterior laxity of the tibia relative to the femur can be assessed by the anterior drawer test or the Lachman test. There's not much of a difference between the anterior drawer test and the Lachman test, except that in anterior drawer test, the patient is made to lie supine, whereas in Lachman test, the angulation is about 30 degrees flexion, whereas in anterior drawer test, the patient's knee is bent at 90 degrees flexion and the test is performed. Any laxity anteriorly relative to the other knee joint renders it positive. Diagnosis is made with magnetic resonance imaging of the knee to evaluate for other injuries of the knee, which can involve menisci or other collateral ligaments or avulsion of any bony segments. Treatment is with RICE measures, that is rest, ice, compression, and elevation of the joint affected, along with surgery if required.
Applications in physical therapy. The FAST FP included 4 agility tasks to be continued at maximally 4 times. Start up onto a 30 cm height box, L3, vertical jumps, and agility ladder drills. The first task was start up onto a 30 cm height box to a beat of 220 beats per minute for 20 seconds. Subject then complete an L3 around 3 counts. Subject then completed an L3 around 3 counts. Counts were placed 1.5 yards apart in the shaft of an L. Subjects were required to sprint at maximal effort when completed the L drill. Next, subjects complete 5 counterweight movement jumps that reached 80% of their maximum jump height that was calculated prior to data collection. Finally, participants ran forward first and 3 years and sideways facing each direction, through an agility ladder. Subjects were required to place both feet in each ladder space with every tread.
The anterior cruciate ligament, or ACL, is an important stabilizing ligament of the knee that connects the femur to the tibia. It is the most commonly injured knee ligament and is frequently injured by athletes and trauma victims. ACL tears are caused by lateral rotation, backward displacement, or sideways impact of the knee while the lower leg is in a stable position. This can happen during a pivot or a jump. Sports associated with ACL injuries include alpine skiing, soccer, American football, rugby, basketball, and tennis. However, American football players sustain the greatest number of ACL tears from contact injuries. Statistics show that there are between 100,000 and 200,000 ACL ruptures per year in the United States alone. When the injury occurs, the patient would feel a pop in their knee, experience acute swelling, and a feeling that the knee is unstable or giving way. This causes instability with movements such as squatting, pivoting, and stepping laterally, and activities such as walking downstairs. The management of ACL tears depends on the extent of the damage. Acute management consists of rest, ice, compression of the injured knee, elevation of the leg, and the use of crutches. Over-the-counter painkillers and non-steroidal anti-inflammatory drugs provide effective short-term pain relief. The patient may also require reconstructive surgery with a hamstring graft or patellar graft.
Pros and cons. Pros. According to results, the main effects for gender indicated that female jump mechanics places them in a position that causes excessive stress on the ACL as compared to males. When combining the result for both right of left knee mechanics, the risky movement pattern demonstrated by females included increased main and peak internal rotation angles, moment as well as increased main and peak tibial adduction angles and moments. Cons. However, interaction analysis revealed that women's jumping mechanics were negatively influenced during unanticipated trails. Fatigue stayed affected both anticipated and unanticipated trails. However, only unanticipated trails, while participants were in the fatigue state demonstrate riskier movement patterns compared to pre-fatigue movement patterns.
This biomechanical analysis is designed to assess movement dysfunction of the lower kinetic chain. The DMA will provide you with an objective measure of movement dysfunction, give you a clear picture of symmetry and asymmetry between the right and left in single limb testing, the 3 top potential root causes for that movement dysfunction, 3 potential injuries and performance issues that you'll be at risk for as a result of the movement dysfunction. The DMA will also provide you with risk and return to sport ratings, as well as 2 to 3 top corrective exercises that should be performed. If the subject is under a doctor's care or has had surgery, a physician's protocol may apply. Therefore, some of these activities of the dynamic movement assessment may be restricted, for example, plyometrics. You should not perform the DMA in these cases until it's been cleared by the physician. For surgical patients or postoperative patients, standard of practice for functional testing does apply. That means that they should be greater than 12 weeks post-op, they should have full pain-free range of motion, less than 1+ effusion on the stroke test, and greater than 70% symmetry for quadriceps strength. Most importantly, use your judgment. If at any time you feel that this test is unsafe, stop the test.
Israel played in Ecuador. In Ecuador, in 2050, according to the data from the National Institute of Statistics and Census, indicates that of code 276 corresponding to dislocation, sprain, and tears of specific regions and multiple regions of the body, 42, 60 men of 46 women were attended in the country. Of 217 186 were from the province of Guayas. Out of 3,000 trauma consultations, 40% are related to injuries of the knee, joint level, and ACL. Rupture represent 50% of the knee ligament injuries. Conclusion. In conclusion, participants demonstrate significant change in the knee kinematics and kinetics. Fatigue and anticipation states influence knee movement patterns in variable ways, which may indicate an attempt to safely lengthen and cut. Additionally, females demonstrate biomechanics that may increase their risk for ACL injury relative to males. Gender, fatigue, and anticipation conditions had an impact on one another and should be considered when designating sport training programs to reduce risky movement patterns.